Hello, beautiful people. Welcome back to my channel once again with another new vlog. So, it's been a very long time. I have been not posting any video as I was busy. So, guys, today's the video is about regarding the mostly asked question in the interview. So, let's get started with our today's videos. And before that, I would like to request you to please like, share, and subscribe to my channel. Keep supporting me, and let's get started with our today's video. And this will be your part 1, and part 2 I will be posting very soon. So let's get started with our today's video. So guys, let me tell you, these are not like imperfect questions or important, and as it is they're gonna ask. This is just an example question. This is like your mock interview questions, you can say. Before going to your interview, you can just have a glance with these type of questions, as those who are belong to medical lab professionals. So these are an example type of questions, and mostly I will be focusing, this video will be focusing mainly for the beginners who are going to start their job for the first time. So these are the basic questions that every laboratory professional should know. So let's get started. So guys, before going to the interview, just relax, don't feel nervous. I know everyone will be nervous before their interview, but you should have your confidence, you should be self-confident, and you should crack the interview, and you should be very confident with your answers which you are going to give to your interviewer. Okay friends, so let's get started with today's some of the basic questions. Like, firstly, they will ask for your introduction. Just introduce yourself. So be confident and give your introduction in a very good and confident manner. Second thing, if they ask you regarding the more question related to the laboratory, if someone having experience regarding their experience, if the beginners regarding their graduations, their percentage and everything, this will be the basic questions about yourself. Okay, an interviewer, he or she wants to know. And the second thing, coming to your professionalism, they are gonna ask, like, first they can ask you, what do you mean by calibration? Because this is calibration and controls are the foundation for the medical laboratory professional, guys. So this can be a very basic question that they are gonna ask. What do you do in a lab? What do you do to maintain an equipment in your laboratory? The first question will be from the calibration and controls. Okay, so if they ask you, what do you mean by calibration? Calibration is nothing but you can answer to check, adjust, or to determine by comparison with a standard, that is graduation of a quantity measuring instrument. This can be normally you can define them in a kind of sentence like calibration. Why we are doing the calibration? It is just to check and to adjust or to determine by comparison with that of the standard values. The next question, it can be from the quality control. What do you mean by quality control, and what are the different types of quality controls you have in your laboratory normally? So quality control, actually it covers the quality assurance, which primarily concerns the controls of the errors in the performance of test and verification of test results. Okay, and quality control, that is QC, must be practical, achievable and affordable. And if they ask you regarding the types of quality controls, we have two types of quality control, guys: external quality control and internal quality control. So basically quality control, it is of two types, and quality controls we are doing just for the maintenance accuracy of our results. Next, going to the next question, that is regarding the safety management. Why we are doing the safety management in the laboratory? Because to prevent the infection during the work in the laboratory. So safety is a universal precaution for the staff or the person who are individual who are working in the medical laboratory. Okay friends, next question, they may ask you also, what do you mean by HbA1c? So HbA1c, most of the people, they don't know the full form of HbA1c and why we are doing. So it's better to go into the depth that glycated hemoglobin is a form of hemoglobin that is measured primarily to identify the average plasma glucose concentration over prolonged period of time, that is 3 months. It is also a type of glucose test which we are performing mostly to check the glucose levels in our body for the prolonged time, that can be maximum to minimum of 3 months. Okay, this can be your question. And the next is, what do you mean by STAT? Usually they are in our medical laboratory terminology, we use TAT. What do you mean by that? If they ask you, TAT stands for turn around time. So TAT time for any test, mostly it will be for the urgent samples, just like RBC, CBC, routine urine, stool routine, and total bilirubin, sodium, potassium, and bicarbonate. So these are the urgent samples. They will ask you what will be the TAT for this test. So it can be like turn around time for these kind of result. TAT is nothing but like urgent sample. Mostly we are using it for urgent samples. Next, moving on to our next question is, they may also ask you what are the different types of test tubes we are using or vacutainers we are using in our laboratory. Or they may also ask you regarding the order of draw. For the order of draw, you can also check my previous video. I have already mentioned the order of draw. So if they ask you regarding the different types of vacutainers and the order of draw, firstly you can say, if they ask you regarding the order of draw, then you have to mention them in the order of draw how you are using. If any one of you don't know, guys, you can check my previous video where I have properly mentioned order of draw, okay, with all the full forms. So if they ask you different types of vacutainers which you are using, you can say EDTA. And mostly, guys, they may ask you, most of us, we don't know the full form of EDTA. So these are the silly questions which we are unable to answer sometimes. So we should be very perfect with these kind of questions, guys. So EDTA, what do you mean by EDTA? If you say like EDTA, plain lithium heparin, sodium citrate, fluoride oxalate, sodium heparin, these are the different types of vacutainers we are using in the medical laboratory. But if he or she, your interviewer, can ask you, can you tell me the full form of EDTA, then you will be having one question, guys. So this is a silly question, but it will trigger your interview. So that is the reason, guys. So better go with the full form, that ethylene diamide tetraacetic acid, which is also called as purple tube, or short form is EDTA, which is mostly used for the CBC and differential count, and also for HbA1c samples. So this is the one. If you are going for the next question, you may expect, like normally they are asking about the crystals, urine crystals. What are the urine crystals? What are the different kinds of urine crystals you observe when you do the microscopy with your urine sample? So you can be like, we have mostly acidic crystals and alkaline crystals in the urine, guys. So for the acidic crystals, they can include amorphous crystals, uric acid crystals, calcium oxalate crystals, and hippuric acid crystals. So these are the urine crystals for the acidic. These are for the acidic crystals. Next, coming to the alkaline crystals, triple phosphate and amorphous phosphate crystals. So these are the different types of urine crystals mostly commonly you will be using. Then coming to the alkaline crystals, ammonium biurate crystals, calcium phosphate crystals, and calcium carbonate crystals also. So these are the two different types of urine crystals which they may ask you. And coming to the next question, the basic question, if you are working in the laboratory, what will be the room temperature? Then you will be like question mark, guys. So this is also a silly question, basic question, but most of the people, they cannot answer, they were unable to answer. So the normal laboratory room temperature will be from 18 to 25 degrees Celsius. It was always measured in the Celsius degrees. Okay, next, moving to the next questions, and they may also ask you regarding the errors, guys. What are the different kinds of errors basically you are facing while you are working in a medical laboratory? So errors, we have another separate topic which I will be also uploading the vlog for that, guys. But for now, what if they ask you what is the main and the basic patient identification you are going to do? So your answer should be like patient name, patient age, gender, and also the patient health number. So every hospital have their file number or health number or patient number. So from this, above all this guys, sometimes we have the similar patients with the similar name, similar gender and similar age also sometimes, but their mobile numbers can give you a brief differentiation between both the patients. So these are the basic patient identification criteria. Okay, next, moving on to the next question, like if sometimes they may also ask you, if you receive a CBC sample, your action in case of if the patient have high WBCs, what you will do. So you will be having the question. So it's nothing guys, you can just explain them. We need to check the sample whether there is any clot. If not, check the sample, mix the sample, repeat the test again, and then you should prepare a thin blood film for that. Okay, for the microscopic counting. So this is the one you can say that in your in case of high WBCs, we can just mix the sample once again, repeat the test once again, and you can also prepare a thin blood film. Next, moving on to the next question is like normally urine routine and stool routine. What are the macroscopic and microscopic readings according to you should be in urine and stool? If they ask you, then for the urine, macroscopic structure should be color, pH, consistency, glucose. By the strip method, if you are doing, these are protein, ketone, specific gravity, nitrate, and this one. If you are going for microscopic structure guys, it should be RBC, WBC, crystal, cast, epithelial cells, mucus, and other than this one, you also you can see also cystosoma, hematobotium, and trichomonas vaginalis in the urine microscopic structure. Then if they ask you regarding the stool structure, for stool also normally macroscopic, which can be seen with our eye. So just by seeing the stool sample, what are the microscopic identification you can make? Normally we are checking the color, consistency, blood, mucus, and other organisms like worm and segments. For this is for the macroscopic. If you go for the microscopic, which you will be observed under the microscope, it can be pus cells, RBCs, ova, cyst, trophozoite, and others like bacteria and yeast can also be observed in a routine stool sample. Okay friends, so these are the different types of questions they may ask you. And moving on to the next question, they may ask you about the normal values also, just like the hemoglobin value in male and the female, hematocrit value in male and the female. So this is the one they may differentiate in male and female also, and with the normal values also I will ask you to be thorough with your normal values. Next, moving on to the next question, you may also expect they can ask you what is accuracy and what is precision, because quality control, safety management, controls, calibrations, accuracy, precisions, these are the very important standards for the medical laboratory department, which everybody has to know regarding this one guys, because we need to have the accurate result for the patient report. Okay, so this is why we need a good result. For that reason we need to do the controls and the calibration. So these are all an important part for the laboratory. Next, if they ask you what do you mean by accuracy, the accuracy is a measurement system, is the degree of closeness to the measurement of a quantity to that of the quantity's actual, that is true value. Accuracy, you can say that you can say accuracy like it is closeness to the true value. Then if they ask you regarding the precision of a measurement system is also called as reproducibility, okay, or repeatability. Precision, this is the difference between accuracy, will always tell you regarding the closeness of the true value, accurate value, you can say. Accuracy, accurate is also same, but coming to precision, it is a measurement, you can call it as reproducibility, or repeatability is the degree to which repeated measurements under unchanged conditions should show the same result. So this is the difference. Sometimes they may also ask you to differentiate between accuracy and precision, so be careful with this one. So if you know the definitions, you are able to tell them the difference between the accuracy and precision. So guys, sometimes they may also ask you regarding the biomedical waste management. So what do you mean by biomedical waste management? Why we have the biomedical waste management? Why we are using the different color coding for biomedical management in the laboratory? So sharp containers also we are using in the laboratory. So these are the basic questions why we are using. So guys, this is your part 1 for the most questions. Mostly you can expect this kind of questions after your self introduction. I'm not saying that these questions are the perfect one, but as an idea for the beginner or for the experienced persons, this can be an accuracy questions, you can say, like relatable questions you can expect in your interview. So guys, this is part 1, and part 2 I will be coming with more questions for the interview. We have the more I have part 2. So guys, this is what I want to tell you. So all the best guys, whoever going for an interview, all the best. Be prepared and be confident with whatever the preparation you have done. So please go with the flow, go with the confident. So with this I would like to end this video, and hopefully I will be back with the part 2 for the mostly asked questions in an interview. Okay, thank you guys. Please make sure that you like, share and subscribe to my channel. Keep supporting me and take care guys.